Welcome to the Private Practice Startup Podcast, where we help mental health professionals grow their dream practices and live a life they love. We chat with successful private practitioners, business coaches, and marketing experts, bringing you tons of practice building tips. We invite you to take advantage of our private practice paperwork and our signature marketing e-course. And we have a gift for you. This is the exact methodology we use to create our six-figure private pay practices and have helped many other therapists do the same. Go to privatepracticestartup.com and on the homepage, click the button to download a free copy of your dream private practice playbook. Now on to today's episode.
Hey everybody, welcome back to another episode of the Private Practice Startup Podcast. We hope you guys are doing fantastic today. And if you're not, we hope that you enjoyed this podcast and hopefully it'll bring some cheer your way as we're talking about growing a concierge mental health practice. But before we dive in and introduce our guest, I want to make sure that you listen to last week's podcast because Kate and I tackled that one and we talked about the importance of reviews. So there's a few of you that are listening right now going, but we can't get reviews. We're therapists. We can't solicit our clients. Then you need to actually be listening to this podcast. We're going to talk about the reviews, importance of reviews, how to get reviews without soliciting your clients. So definitely check out that podcast because reviews are so very important to your business. All right, let's talk about Dr. Brook, who is an MD concierge, and she's a concierge psychiatrist. Dr. Brook Choulet is a concierge psychiatrist, founder of Choulet Wellness in Scottsdale, Arizona, and co-founder of Jolla Concierge Psychiatry in San Diego, California. Dr. Brook completed an accelerated 6-year BA MD program and obtained her medical degree at the very young age of 24. She started and grew 2 private practices at the age of 28 before finishing her fellowship training in child and adolescent psychology. She solely practices concierge psychiatry where her clients communicate directly with her. I think Dr. Brook is going to have a lot to share with us. She has a lot of successes early on in life, so we can't wait to dive into this podcast. But before we do that, it's only appropriate to take a quick moment to thank our sponsor.
Insurance billing can be frustrating and difficult to master, especially when you would rather be spending time with your clients or building your private practice. Practice Solutions is a full-service billing company that specializes in the mental health industry. Whether you're a solo practitioner just starting your practice or a large group practice, hiring Practice Solutions to take care of your insurance billing can yield more time that you get to reinvest in your business. Practice Solutions can not only give you back your time, but can also give you peace of mind on revenue streams with consistent and communicative billing practices. They've helped clients reclaim thousands of dollars in unpaid claims. According to a current client, Practice Solutions has been amazing for my practice, its growth, and my peace of mind when it comes to billing. If you're looking to add a friendly and reliable billing expert to your team, reach out to Practice Solutions by filling out a contact form at www.practicesol, that's practicesol.com/startupnation or calling 734-437-9432 extension 709 to learn more.
Dr. Brook, welcome.
Thanks so much for having me today.
It's a pleasure. And thank you so much for making the time to be here with us today. Before we hit record, you said you're moving into a new office, waiting on furniture, and there's lots going on. And I know Kate can totally relate to all of that chaos, making it all happen all simultaneously.
Yes, it has been quite the challenge.
Very cool.
Yeah, it's so exciting to grow your practice like that. And I know we were chatting a little bit earlier. You had hired someone to help you with the interior design aspect, and it's going to be so cool to see it all come together. That's one of my favorite aspects about growing a practice is growing the team and the designing element of seeing everything come together. So we look forward to seeing that. And we're glad to have you on the podcast today to talk about a concierge mental health private practice. But first, tell us a little bit about your story and how you became a psychiatrist.
Sure. So it all started with my mom and grandpa, who are both child and adolescent psychiatrists. My grandpa worked more in academic psychiatry, and my mom went more the private practice route. Growing up, I just loved seeing, like I'm sure you guys enjoy, the flexibility of scheduling your own appointments, kind of being your own boss, and choosing the patients that you feel really passionate about working with and kind of want to get better over time and have that buy-in in terms of that non-insurance based practice. So I matched out to Arizona for my adult psychiatry residency and then my fellowship here as well. And I think a lot of physicians and early career psychiatrists definitely like to stay more kind of conservative and get a job out of training and then slowly build a practice. And I really wanted to build something during training. So right when I was done, I could kind of just slide right into it.
Wow. I love how crystal clear you are. And how old were you when you decided you wanted to be a child and adolescent psychiatrist?
Probably about 18 when I joined that 6-year program.
Got it. And so growing up with a mom who had done this, did that kind of pique your interest, or was it just like, that's just what mom does?
I definitely think it piqued my interest. She's always ran solo though. So she's never had a group up until 2 months ago when I encouraged her into it. But she's always been solo, and I really liked just her ability to be with us during, the time we were growing up, and then also really making a difference in a lot of people's lives.
Wow. She must be so proud of you and all that you've done and encouraged her to grow this group practice and really helping her as well. That's
yes,
amazing.
Definitely.
Cool. So tell us, what do you like most about the work that you do with your group and your team?
Yeah, I love the concierge touch. I really like communicating directly with clients. And so when I was growing this group, I found other people who maybe they weren't as familiar, but they were really interested by that concept because not a lot of people do it, either concierge therapy or psychiatry. There's just not a whole lot out there. So I really wanted to provide a direct care to the community where people could get a hold of me by text. I could go to their home. They could come to the office and just offer a variety of services.
Very good. Very good.
Yeah. Tell us a little bit more about what it means to have a concierge private practice for people who may not be super familiar with that model.
Sure. So I think one thing is accessibility. I know a lot of private practices, there are a lot of people who are solo out there, but typically it's kind of been 8 to 5. Messages after hours are checked the next day and only urgent ones are returned. So I think that there's a slight difference where they can contact me at any time, which I know a lot of people are really scared by. The first question they ask is like, do you get calls in the middle of the night? And I'm like, no, I don't. The people that want to work with me and that want concierge services are really high functioning professionals themselves, and they just like that convenience. So I think it works well for me. And I think that it just seems like a big risk or seems scary to other people until you try it.
For sure. Yeah, it just kind of reminds me, I know Kate, her younger son, has had many colds recently, and there's many times that we're sitting in our meetings and like her phone's there and she has a watchful eye on it because when she calls the doctor, she has to wait for the doctor to call her back, and it's like, hang on, I gotta go. You know what I mean? And so being able to communicate directly, with other busy people, having busy entrepreneurs and professionals, like that is really a invaluable thing. So that's very interesting.
Accessibility is so helpful. It really is, especially for professionals who are so busy and schedules are crazy. And when you're going through something difficult, or you're in a crisis, or you're just having a regular question, wherever that need falls, it's so nice to be able to have that high touch point. It's kind of like an MD VIP type for the medical professional, primary care physician. So this is the concierge MD VIP for psychiatry. Awesome.
Right. And I think the other thing too, for all the business owners out there who do own their practices, is that it's a kind of a win-win from both a clinical standpoint with patient care and from the owner standpoint, because we have a phone tree set up for after hours. That's like, press 1 if you're trying to get a hold of this doctor, press 2 if you're trying to get a hold of this therapist. And it directly shoots them to their mobile phone through a Ring Central phone tree. So there's no need for after hours coverage at all, or outsource kind of call centers.
So everyone that joins your team is part of the concierge modality.
Yes.
And I guess I'm curious about additional things that differentiates you from the traditional, typical private practice model. So tell us a little bit more, in addition to accessibility, what makes you all different?
Sure. So I provide home visits for a lot of professional athletes or other doctors or people who don't want to be seen in a clinic setting. So myself and then one of the sports psychologists in my clinic were the mental health team for the NBA Phoenix Suns. And so we have that flexibility where we could go to the training facility or we could go, wherever they need us to their home. So I think it's like one step above that traditional private practice where if someone's like, I had someone last week, like, hey, I'm like running 20 minutes late to your office. And I'm like, do you want me to just pop over to your house? I'm 2 minutes away from there. And they're like, sure, that would be fantastic.
Wow. And I'm sure people listening are wondering two things. One is, when you have this concierge practice, like how do you set the boundaries up front with your clients and like how do you communicate about that? And then two, I'm sure people are wondering like if they want to go in this arena, how did you develop these contacts and connections? But before you answer those two big questions, just let's take a quick moment for our sponsor.
Is managing your practice stressing you out? Then try Therapy Notes. It makes notes, billing, scheduling, and telehealth a whole lot easier. Check it out and you will quickly see why Therapy Notes is the highest rated EHR on trustpilot.com. With over 1,200 verified customer reviews and an average customer rating of 4.9 out of 5 stars, you'll notice the difference from the first day you sign up for their free trial. They offer live phone support 7 days a week. So when you have questions, you can quickly reach someone who can help, and you're never wasting your time looking for answers. If you're coming from another EHR, they make that transition really easy. Therapy Notes will import your client's demographic data free of charge during your trial, so you can get going right away. Use the promo code PPS as in Private Practice Startup, that's PPS, to get 2 free months to try out Therapy Notes for free with no strings attached. And remember, telehealth is included with every subscription, absolutely free. Make 2022 the best year yet with Therapy Notes.
Feeling anxious heading into tax season? You are not alone. That's why therapists turn to Herd. Built and designed specifically for clinicians in private practice, Herd offers affordable bookkeeping services, personalized financial reporting, and tax assistance to ensure you're making the most of your business and your time. Herd saves therapists on average $5,397 on bookkeeping and taxes each year. That's amazing. And when you join Herd, you'll work directly with financial specialists to track your income and expenses, file taxes online, and grow your private practice. Sign up now at joinherd.com. That's joinherd.com. So 1, boundaries. 2, how did you develop the connections?
Sure. So the boundaries, I think, is pretty important to set up from the start, like you said. Otherwise, you can get into this flurry of back and forth. So it does take really kind of assertive approach and firm boundaries. So I make the comparison to people that I bill like a lawyer. So it's how much time you want to use me. So if you want to just come in for your once a month med checks or therapy sessions, that's totally fine. If you want to text or call me, that's also fine. So I give the patient kind of the autonomy to use that service however they'd like, which is why I really dislike retainer-based concierge services. And that's another thing that makes this unique is most people are retainer-based. You pay one fee for the year. And I think it takes away the patient autonomy to choose their own clinician. And when you're tying them in for a year, because it may not be a good fit. So I think it provides more accessibility cost-wise to the community to have kind of that a la carte, like just however much time you need is what you'll be billed for. And then in terms of the contacts, so I just worked really hard to meet with so many people in the area, have so many coffee dates and lunch dates, really put my name out in the community with everyone that I talked to. So I had on another podcast, someone asked like, what was my big marketing campaign? And I was like, it was just me. Like I would email people and be like, I would like to meet with you, or here's something I'm doing. And that's actually how I kind of grew this practice, was through having those coffee dates where I was simply telling people what I was doing and what I was planning to do. And they were like, that sounds really cool. How can I join you?
So it was just you and some coffee.
Yep.
And an invitation.
Yeah.
That's free marketing.
Yeah.
Right. I think so much about what we do is about personality too, and relatability. And I think people don't want to pay cash rates if they think that you're, not the right fit for them or boring in some sense or not relatable. So I think that personality is just so key, especially in concierge too, when they are paying a high premium to see you.
For sure. So I know we kind of like went micro and in different areas, but let's kind of just take a step back. And how did you develop the vision for this? Did you get coaching? Did you follow a model?
So it was really kind of not according to the books. I was getting a facial, and the girl I was talking to is telling me about how unhappy she was in her job there, and how she wanted to go somewhere else. And it got me thinking, like, I should do like a wellness center with both mental health and wellness kind of services. And there's way too many med spas in Arizona, so I certainly did not want to go down that route. But so much of what we preach to our patients is self-care and kind of taking time for yourself. So I was like, well, I was planning to do this alone, but now I'll look into kind of getting a larger office. So at first it started with just me looking for a 2-office space where I could have her and myself. And then, like I said, as I was meeting with other people and getting interest, then I was like, okay, that's it. I'll sign for an 8-office space and hope for the best and just kind of see what happens. So that's kind of how it got started, was really non-traditional, just kind of piecing this all together. And I'm really happy with the finished product.
Awesome. Very cool. So tell us like about the development of it. Like, who did you hire first? Was it more of the wellness aspect, mental health, and how you've structured a lot of that?
Yeah. So at first it was the esthetician. I'm like, well, I know you're in, so that's great. But no, then I did start looking for therapists and psychiatrists. So I have one LPC, a few psychiatrists, MD/DOs, and then a few psychologists, PhDs, and PsyDs. So there's a whole spectrum of different licenses. And then we also have a nurse injector. So, having the kind of lease that I signed for this 8-office space, I was in a rush to hire on people. And it was nice because they all have a different niche. So it's not like if a client calls wanting to schedule for therapy that there's 5 therapists I have to fill that all kind of want the same thing. So they're all really kind of differentiated.
Got it. Tell us a little bit about how your business model is set up, because you mentioned hiring, you were in a rush because of the office space to really fill the space with the right clinicians and hiring them. So tell us a little bit about how your practice is set up business model wise.
Sure. Yeah. So they're all independent contractors. I tell them from the start, you set your own hours, you determine when you want to work. It's really up to you. So they can block off their schedules when they don't feel like working. They can let us know their availability, and then they have the flexibility to schedule their own follow-up appointments. So we help screen the initials, schedule the initial appointments, and then they, from there on out with the concierge model, they communicate directly with their clients. So they're in charge of their follow-up scheduling and communicating. And then in terms of the kind of back-end business things, we provide a lot of admin support. So marketing, EHR, phone tree, things like that allow them to basically walk into a turnkey private practice.
Nice. And how have you recruited your clinicians, doctors?
The doctors and clinicians, really, it honestly, I think only one I hired from Indeed, but the rest really were just from meeting with people and telling them about what I was doing.
Nice. And what do you do for marketing?
For marketing, we do Google pay-per-click ads. We have a well-developed website with good kind of SEO backing. We did some traditional like postcards to pediatricians' offices, internal medicine, other concierge doctors in town. And then I really haven't stopped with connecting with people and meeting with people, getting involved in the local child psychiatry Arizona branch community. So that's really all we do. The Google pay-per-click ads are the only paid marketing we do.
Got it. And then how does the fee structure work for, each therapist, doctor, and how is that kind of explained to clients? I know you said it's kind of a fee-for-service basis, not a retainer.
Mm-hmm. Yeah. So when people join, since they are independent contractors, they do have a right to set their own fees. So I give them the broad spectrum of what the other people in the different licensing roles charge, and they could determine their own rates. But it's just based on a 60-minute initial eval or 90-minute for children and adolescents. And then its follow-ups are billed at 30 or 45 minutes. And then for every 5 minutes of phone, text, calls, letter writing, anything like that, we bill for that time as well.
Got it. And so if someone's thinking about starting their own concierge practice, what are some recommendations you have? What are some maybe mistakes that you made that you would say to avoid?
I think one mistake I made in the beginning during that kind of like rush to hire people where I had this massive lease payment coming up, I made the mistake of hiring someone that probably wasn't the best fit. And I very quickly learned that, they were trying to juggle a few kind of side gigs and weren't dedicated to patient care. And I don't want the quality of the practice to be sacrificed. So I very quickly had to terminate that relationship. And I think that was the biggest mistake that I would advise people, is to really make sure it's the right fit and that you're hiring for the right reasons. And then in terms of recommendations, I think just having an attorney and having an accountant are so important, because I can't tell you how many people I've talked to, other practice owners or physicians, who were like, oh, I found these forms online and hopefully they got a lawyer. And it's like, no, this is not okay. This is your business kind of at stake here. So I think having an attorney and an accountant is so important.
100%. You were mentioning something about hiring before. That's an area Kate and I love to talk about. We're curious, when you say hire right, how do you assure that this person is a good fit?
I think and I'm sure you guys feel this too from your work in therapy, and for me from being a psychiatrist, I feel like I can get a good feeling from people pretty quickly about their, if they're genuine, what their work ethic is. I certainly ask for references. I talk to other people that they've worked with in the past. And then I look at, obviously, on their resume, if they've moved careers a lot, if they were at a place for only a short period of time, why might that be? So I think really just getting the whole picture of a person is important, and obviously a background check, because you want to make sure that the people coming into your business are treating it like, the baby that you want it to be treated like.
Exactly. And tell us, Brooke, what are some plans for expansion of your model, of your practice?
Yeah, I'd like to open another location in Arizona. And then I would like to expand the group practice in California, because right now that one is solely physicians, and we're desperately needing therapists for that practice. So I think I would like to expand that one in the next 6 months as well.
Nice. And I think it's a very good business move, because you can do a write-off to fly home and visit family while you're working on your business. Just saying.
Yeah, maybe even get a second home office over there or something.
Exactly. Very cool. So anything else that you think is important to add in this discussion that we didn't cover?
I think in the beginning, just like, anyone that started a group practice, it just seems like you're drowning in a to-do list with lots of work, and that you're constantly thinking ahead of what you might be missing or what holes there might be in your liability and HIPAA and, all of these things. And so I just think it's important to remind yourself to take time for yourself, because it can feel like you see the light at the end of the tunnel and you're never getting there. So I think making sure to take that time to unwind will make you perform better in the business in the long run.
Very cool. Very cool. And what do you hope our listeners most take away from your message today?
I hope they take away just learning about a new kind of practice, and if it's of interest to them, maybe looking into it and pursuing it, because I think there are so many patients out there who really want this level of service. And I think a lot of times people might think like, oh, it's just only wealthy people can do this, or, patient wise. But, we see a broad spectrum of patients that are just really needing that care, and they're prioritizing their mental health. And so I think, it's really kind of a unique model that I hope will, become more popular in different areas.
Awesome. Well, we so appreciate you being here today. And I know that if you are interested in a 15-minute consultation, transitioning your business to a concierge practice, you can actually schedule that on your website, and we'll go ahead and put that on the show notes page.
Wonderful. Thank you guys so much. And I think that your resources are such a wonderful resource for people getting started. And I just love your material. So I definitely think all the listeners should check that out if they haven't already.
Thank you so much. We appreciate it.
Yes, it was awesome having you on today. And this is, believe it or not, I mean, what episode is this? This is, we're nearing 300 episodes here, and we have never had anybody talk about this. This is episode 288. So it's really cool to have you come on and present a different topic and niche-based model for Startup Nation, so they can really think outside the box when they're creating the business structure and vision that they really want to have that's going to fit the life that they want to lead. So thank you so much for being here in Startup Nation. We hope you enjoyed this episode as much as we did. We want to encourage you to subscribe, rate, and review the show. You can always do that on our show notes page. And of course, share with any friends or fellow colleagues who would benefit from this episode. And we will look forward to seeing you on the next one. In the meantime, stay inspired.
Take care, everybody.
Thanks for joining us on The Private Practice Startup. Visit theprivatepracticestartup.com for awesome resources, free trainings, attorney-approved private practice paperwork, and so much more.